There are 8 different functions the kidneys perform other than filtering blood, and they are maintaining homeostasis or balance of solutes like electrolytes and water. Stimulates bone marrow to produce hemoglobin, which is the oxygen-carrying particle on top of red blood cells for red blood cell production. Kidneys are able to perform this task due to their ability to produce a hormone called erythropoietin, or EPO for short. Produces the active component of vitamin D by releasing hydroxylase. The kidneys are the only source that produce this active component. Regulates blood pressure. This is possible by the kidney's ability to secrete renin, which controls blood pressure. Catabolizes small peptides like insulin. Catabolize means to cause the breaking down of more complex structures into simpler ones. Can produce glucose, the simplest form of sugar. While the kidneys are not known for this function and it is not their priority, they are able to perform this task. Eliminates drugs through filtration. Controls the pH levels of your blood. Your pH levels are the measure of the acidic and basic qualities of your blood, ranging from 1 to 14. Balanced is around 7, and normal for humans ranges from 7.35 to 7.45. Any more or less can be fatal. Isn't it amazing that the kidneys can perform all these other vital functions? But let's discuss the kidney's main function, filtering blood. How exactly does waste from the blood get filtered out? Blood is filtered by 3 main processes: glomerular filtration, tubule secretion, and tubule reabsorption. Glomerular filtration occurs when blood flows through the glomerulus under high pressure, and small substances are filtered through a sieve-like membrane. This membrane acts as a colander. It keeps the big particles in, and it lets the smaller particles drain out. Larger substances, like plasma proteins, remain in the blood. The filtered liquid travels down into a tubule called the proximal convoluted tubule. In tubule secretion, the second process of filtration, substances flow into the nephron further down the tubules. Some drug metabolites, or any substance produced by or taking part in metabolism, are secreted in this way. In tubule reabsorption, the third process of filtration, substances that go into the nephron exit the tubule and flow back into the blood. This process occurs with particles that are beneficial to the blood and body, like electrolytes, amino acids, and water. Although these processes are vital to kidney function, the best overall index of kidney function and renal mass is the glomerular filtration rate, or GFR. The glomerular filtration rate is how many milliliters per minute are being filtered through your glomerulus. Normal is about 120 milliliters per minute. I've discussed how the kidneys and their tiny structures are supposed to work, but what happens when the kidneys aren't working correctly? There are 2 different types of kidney failure: chronic kidney and acute kidney failure, or CKD for chronic kidney disease and AKI for acute kidney injury. Chronic means that the condition occurred over time, and acute means that the condition occurred suddenly with no warning signs. However, CKD, for chronic kidney disease, can be accelerated by the following risk factors: high blood pressure, diabetes, and old age. Elderly people are the most susceptible population to CKD. This does not mean that nobody else from any other age groups will develop CKD, but as we age, our bodies don't function as well. Symptoms of kidney disease, both CKD and AKI, include back pain, as the kidneys are located in your back, blood and urine, and fatigue. When kidneys can no longer filter blood well enough to sustain life, toxins will build up in the blood, and a patient will need dialysis to live. Dialysis is basically artificial filtration. It is done with a mixture of water and chemicals that remove waste from the blood without taking away vital substances. There are 2 types of dialysis: hemodialysis and peritoneal dialysis. Hemodialysis is done through arteries and veins joined together to make a fistula. Patients have an IV attached and a tube that leads into the dialysis machine to filter their blood. Peritoneal dialysis is done through a catheter inserted into the abdomen. It is called peritoneal dialysis because your abdominal cavity is sometimes known as a peritoneal cavity. Fluid is transferred into the abdomen, and when wastes are drained out, they go out through the catheter and out of the body. Dialysis is meant only for patients whose kidneys have failed, but here are some tips to keep your kidneys healthy. Drink a lot of water. You need 8 to 10 glasses every day, and this helps flush the toxins out of your blood, which your kidneys do, but this will help ease the workload on them. Cranberry juice is also thought to be beneficial and cleansing to your kidneys, and Ocean Spray's cranberry juice even received an award from the National Kidney Foundation for being so beneficial. This concludes my video on kidney function, and also my videos about anatomy and clinical trials. Thank you all very much for watching my videos. If you are still interested in learning more about kidneys and their functions, please visit these websites. Until then, thank you and goodbye.